This webinar is going to be about vaccination of young, I don't want to call them young adult, but they're children and youth, because we have people who are 16, 17. They say to you, we are mature here in the UK. So I'm very delighted and I'm very pleased to have with me 7 or 8 people, starting by Dr. Salma Elfaki, who is a consultant pediatrician. She is in Florida and she has led this first trial in Florida. Last time we interviewed her, she was leading the trial of the Moderna vaccine for children in the US. And at that time, people were trying the vaccine for the children. On children, we already, the adult, there has been a rollout of the vaccine across the whole world. The vaccine has proven its success with adults, and I think many countries have started to refer to it as even as an exemption now to travel, to come back, to enter the UK. For example, in the UK, if you are you have the double jab across Europe or America, you can enter the country without any quarantining and so on. So the vaccine has proven itself. The Prime Minister here, he said and he argued that we can now, even people, they can go to even nightclub if they are vaccinated. That means this is where there is no social distancing. So the vaccine has proven themselves on the adults, and I think that's why many countries, particularly in the UK now, they have speeded up their process to try to vaccinate the young generations. Interestingly enough, children across the world, particularly in the US, in Canada, and I also learned in Uganda from Professor Joseph Natai, who's going to get us 2 from Uganda. They already been vaccinated. So interestingly, children have been vaccinated across Africa. I think a month ago, Chinese vaccine have been started to be produced in Egypt, which means Africans can actually have the vaccine now available from Egypt. The first dose was 1 million dose was produced in Egypt, I think a month ago, less than a month. So there are lots of progress toward the vaccine production. So we have Dr. Salma, who is going to talk to us about vaccination of children, the vaccine itself, any issues with the vaccine, from the trial she led last year, plus her experience so far. She is managing her own clinic in Florida. She is a certified pediatrician. She is a consultant. And also she has quite a wealth of experience with children. I am going also to invite Dr. Nona Abdelaziz from Manchester. She is a public health director in Manchester to give us the latest protocol here in the UK. And we are very delighted to have 6 or 7 children who have taken the vaccine or they're about to take it. So just because we spent, I think we lost like 5-6 minutes on connection. So Dr. Salma, thank you very much. شكرا جزيلا بالعربي first. Thank you very much. I know it's very early in Florida. You have always been very keen to help others with what you know and what you have practiced. Dr. Salma, you have told us last time when we interviewed you, I think this is, I can't remember, 9 months or 8 or 7 months ago, that you were leading at that time, or you were the first clinic in Florida to start the trial on children vaccination for COVID-19. So maybe perhaps the first thing, tell us the results of your trial, which you started, and now the vaccination of children is a reality because Maya and Aya, you'll see them, they've already been vaccinated. So children are now being vaccinated. And in the UK, I think Nona is here, but there have been lots of concern for young generations vaccination. So tell us about the result of the trial and give us some figures about efficiency, effectiveness of the vaccine, and the concern you have learned about them. I remember we had lots of issues before with the adults, and many people have many issues about the vaccination. But the good news, many people are now lining up to get the vaccination. And the number of people taking it within Europe and across the world is very high. So that means we don't need to talk about this, but maybe with children, the story is different. So Dr. Salma, I will give you the floor to talk to us about your trial and what can you say about vaccination for children, not just from the American perspective, but globally now.
Good morning, Patricia. Good morning in Florida, professors. Alam, thank you for inviting me today. Just a brief introduction. My name is Salma Elfaki. I'm a pediatrician in Orlando, Florida. And I was selected as the only site in the state of Florida to run the Moderna brand COVID vaccine trials in teens, ages 12 to 17. We did this back in February, we started, and we had a huge turnout, alhamdulillah, and a lot of kids were able to participate. We got the results in June, finally, and as far as the Moderna vaccine was concerned, the trial collectively across the country, which involved over 3,000 kids, the vaccine was 93% effective after the first dose and 100% effective after the second dose. So these are great numbers, very reassuring. We're still continuing to monitor these kids, and so far so good, alhamdulillah. As far as the Pfizer vaccine, which is currently available, the 2-dose series as well has about a 96% efficacy. What this means is out of 100 people who are vaccinated, only 4 or 5 can catch COVID and the rest won't if you're exposed. So these are very, very effective vaccines. The safety profile is excellent. And really, there's no reason for people not to go get these vaccines. Obviously, you know, I take care of kids and teenagers. I've been doing this for years. And this pandemic has really impacted our youth in a negative way. The rate of mental health issues associated with lockdown, people getting sick, losing loved ones, school going online, offline, whatever, has been, the mental health impact has been disastrous on kids. We lost a lot of children to suicide. A lot of kids are depressed. But now, you know, with this vaccine, with the vaccine, there's light at the end of the tunnel. There are unfortunately, at least here in the US, the issue has been politicized, even though it's a public health problem, not a political problem. And a lot of misinformation. There's a huge misinformation campaign, conspiracy theories, all kinds of things that are being spread and just shared across platforms, social media, and whatnot. What I want people to know is that millions of people receive vaccine, millions are doing well, and as the CDC had mentioned, this is now a pandemic of the unvaccinated. So if you have an opportunity to go get your vaccine, regardless of which brand it is, you should, and please don't hesitate. Obviously, you need to talk to your physician as they know what your health state is, and if you would be eligible, go ahead and get it.
Okay, Dr. Salma, thank you very much. Salma, very briefly, the success of the vaccine on children. I know you somehow or another you alluded to, but is it better than the rate on the other or less? Or still you have to do some trial to see? Because most of the studies here in the UK, they have been in the last 3-4 months. Nona will clarify that. We start doing some study on the effectiveness after people have been given it in the last 6 months, December and so on. So the vaccine on children, is it likely to be better, will produce better results, or still not clear, or where we are?
Yeah, from the studies, the data from the studies, it seems to be more effective in children. But this is not surprising. As you're aware, we do vaccines, we give a lot of vaccines in childhood. And children are able to mount a better immune response in general. So what we're seeing from the trials is that it seems to be more effective in kids. Obviously, once it's widely used and more people start taking it and the data keeps coming in, then we'll have a clearer picture.
Okay. And last time I remember when even I watched your interview on one of the TV channels, you were saying that although yes, children, as you said, they are more immune and so on, but we have seen children getting it, but they are quite good. It affects schools and so on. Now, as far as you know, I know you are in the US, you did all this. Across the world, I mean, Mona will tell us about the UK now. How far do you think if countries are taking it seriously? Because many countries, they don't even aware of the importance or even vaccinating, or some of them are still struggling even to vaccinate the adult. Do you have any just general idea of what is the situation likely to be with vaccinating children across Africa, Middle East, and those parts of the world?
I think it all depends on the country's resources. So, the developed countries, they're able to import vaccines, they're able to start vaccinating their population. The other poorer countries, can't think of a better word, I'm sorry. Countries, and the third world countries, that type of thing. There's a lot of logistics associated with vaccine. There's something called the cold chain.
Yes.
That needs to be figured out. I was involved also with a task force earlier this year and helping consult with the Ministry of Health in Sudan on how to develop a good vaccine program and how to get it going in Sudan. So their logistics were difficult. They're dealing also with the same type of misinformation, like I mentioned before, and getting the vaccine there. So supply issues, storage issues, information, and lack of awareness. So these are all the problems that they're dealing with.
Excellent. Salma, some people, particularly those one, I have to say that from the UK, when people start talking about vaccine, and as Mona said, and she will say it quickly now, sorry, I'm going to give her the floor shortly. Are there any worries for those bearers? Bearers, they say, even me, they will say, I am still not, there's many stories coming from the vaccination of the adult. So they take, some are very worried about their kids. We will hear to the Maya and others shortly. But do you really, can you send a strong message to parents, not to add more, if you like, concern and agony to their kids? Schools are definitely supporting any vaccination, all the schools. No school is saying anything. Can you send a very strong message to parents to take this very seriously, particularly in the West, because it's available now. In Africa, I hope we will get these two youngest from Uganda. They have been vaccinated. But can you send them a strong message why they should take their kids, support and encourage their kids to take the vaccine? Say just a message to the people in the UK, for example, or Europe, for example, in general.
So at the beginning of the pandemic, of course, it's a new disease. We were learning, we're still learning about it. Now we know that it's not just life, you live or you die if you get COVID. There's these long-term complications that we're seeing happening with all age groups. Children can die from this disease. And so it has now become an essentially vaccine preventable illness. So it would be such a shame if we lost a life because they chose not to get a vaccine that's been proven to be safe and effective. Furthermore, we're not just preventing death, we're preventing chronic health issues. I have personally patients. I have a 9-month-old baby whose breathing now is disrupted. She was exposed and had COVID when she was a month old. I have a 9-year-old with facial paralysis. Half her face is paralyzed. It's called Bell's palsy. I have 2 or 3 teenagers who developed inflammation of the heart, myocarditis, and they have to be on aspirin and see cardiology for a very, very long time. Fatigue, loss of smell that doesn't come back. These are all issues. And just, okay, they lost their smell, so what? No, you don't understand. These people actually then get into a depression. You cannot experience life. You cannot enjoy your life as you did before. The food doesn't taste right, all kinds of things. So there's long-term effects that impact your physical well-being and your mental well-being. And you can prevent that easily with a vaccine.
Okay. Thank you. And let me just bring Dr. Mona. Dr. Mona is the director of the public health in Manchester. She has done lots of work on awareness, on making people aware about the vaccination for adults and so on and so on. Mona, if you could kindly just tell us about, I know you're going to talk to those particularly in the UK, but I know you're also involved with the Sudan and others, but for the UK and those in Europe, which is now available for them, what is the protocol in the UK? Many people, they still don't know. I know it's available in the government website. What can you say, and how do you send, can you also send a very strong message to those, particularly those who are in the UK, which is offered for them? I received it, my daughter received it, she's 17 years old. So Muna, can you tell us what is the situation in the UK?
Okay. Thank you very much.
The same in Europe.
Yes, thank you very much. So every country has their medical regulatory bodies which look at licensing, they look at the data, the evidence around safety for new medicines or for vaccines, for example. And because this is a pandemic, every country has looked at the COVID vaccines. And the COVID vaccines have been through extensive trials in many countries. And right now, there are some countries like the UK where nearly 70 to 80% of adults have been vaccinated. So this means there's a lot of evidence now that we know about the COVID vaccine, and much more evidence that we know about COVID itself and its effects. Like Salma pointed out, this is now a pandemic of the unvaccinated, because that's where the virus will continue to be transmitted from person to person. And those individuals who haven't been vaccinated will get the side effects, the worst effects of COVID. So the question is, who hasn't been vaccinated yet? So there are about 20 to 30% of adults in the UK who haven't been vaccinated yet. And they're not all against the vaccine. They are just worried about the vaccine as much as they are worried about COVID. The problem is with vaccine hesitancy, and I'm still talking about adults, I'll talk about children. The problem with vaccine hesitancy for adults is that they don't realize that the balance is tipped very much more in favor of the vaccine. The risks, the side effects, nothing is risk-free, but the side effects of the vaccine are 1,000th less than the effects of COVID. So COVID itself causes lung disease. It causes, that is for people who continue to survive the first acute illness, and people have sadly lost their lives to COVID. But people who survived COVID are left with a lot of health implications. They become severely unwell, debilitated, and for some people it is going to be lifelong. The COVID vaccine is only 9 per million people who will experience one of the severe side effects of the vaccination. So it is much, much smaller in comparison. You are more likely to get a blood clot from COVID itself than you are from the vaccine. So it is a balance of risk and benefit. And then when you come to children, which is the topic of today's webinar, children who are just under 18, 16, 17-year-olds, their health profile, the risk profile is almost equivalent to that of an adult. So recently, even this week, the Joint Committee of Vaccination and Immunization, that's the group of scientists who look at new vaccines, they have recommended that 16 and 17-year-olds should now be invited because they will benefit similar to 18 and 20-year-olds and so on. So that is on the basis of their own health, not to protect anyone else. If someone is is age 12 to 17 and they have a health condition that means COVID is going to really, really impact them severely, for them, the vaccine is much lighter. So for a long time now, I think it's been maybe about 6 months, children aged 12 to 17 in the UK, if they have a health condition, they have Down syndrome, any kind of disability, any kind of illness, they have been vaccinated as some of the top priorities. So children aged 12 to 17 have been vaccinated for a long time. For the last 6 months, we have been vaccinating children. They have been receiving the Pfizer, and that was to protect them. Only recently, we have increased that for children aged 12 to 17 who are living with someone who is at a severe risk of COVID because they are immunosuppressed. So we don't want anyone to take the virus into that household. So we are now vaccinating children aged 12 to 17 who are living with someone with a health condition at home. Children who are carers have been being vaccinated for a long time. So already we know about, I mean, beyond the trials, we know the real life impact of COVID vaccine on children. Here in the UK, in the US, as Salma has explained, and other countries, because you did mention in Uganda that some children have been vaccinated already.
Now, Dr. Mona, one thing it has been before when I sent you that message in the group, some people, parents are confusing. I may be wrong, they are not confusing, but they have the right to ask. You remember when that issue about AstraZeneca and the government decided not to give to young generation, which they were talking about 30s at that year. Can you just clarify that? Does that issue of clothing and everything has anything to do with children? Or it was about, because if it's affecting the 30s, people will say it might affect the 20s and so on. And also the people in the children in the UK, they are not going to be given AstraZeneca, am I right?
So children in the UK are now receiving Pfizer. Pfizer
Yes.
was approved in the UK. It followed a trial of about 1,000 children aged 12 to 17 who received Pfizer safely. And now it's being given to children aged 12 to 17 who are eligible for that vaccination, including the 16 and 17-year-olds who are being vaccinated just this week. So the Oxford AstraZeneca is the only one that's available in very hot countries, for example.
Yes.
Because it doesn't have to be kept at minus 70 degrees. Pfizer and Moderna have to be kept at very, very cold, refrigerated environments, the cold chain that Salma mentioned, to preserve that vaccine from the factory in which it is produced right to your arm where it gets to you. It has to be kept at a very, very, closely guarded temperature, very, very low, minus 70 for Pfizer. So in the UK, Pfizer has been approved for use among children. And that's the one that children are receiving now. You mentioned Oxford AstraZeneca and some of the side effects. You mentioned blood clots. Well, COVID is more likely to give you blood clots than the COVID AstraZeneca vaccine. However, just because to be precautionary for the balance of risk and benefit, the government, health authorities, the Joint Committee for Vaccination and Immunization here in the UK have advised people to use the Pfizer instead of the Oxford AstraZeneca. But people who did receive Oxford AstraZeneca, their first dose with no side effect, they got the second dose Oxford AstraZeneca as well, even if they were age 12.
Okay. Now, Mona and Salma, Dr. Mona, Dr. Salma, let's hear few examples from children who have taken it, and their questions start to come here. Now, may I start by Maya? Who want to go first, Aya or Maya? Any one of you can go first. You both been vaccinated. You are in Canada, right? Tell us, Maya or Aya, any one of you, and then we come to the second one later. Let's take example from Canada. You are 13 years. Who want to go first? Tell us, how did you get vaccinated? What I mean, who encouraged you? Who told you? Is it your parents, your teacher? Were you convinced? Did you have any concern? And what happened? So either Maya or Aya, one of you can, yeah, go Aya. Aya Hassan from Canada. Tell us your experience with the vaccination and tell us about who you are. You are 13 years old, I believe. Go, yeah, Aya. I will unmute yourself, please.
So my name is Aya, and I'm 13 years old and currently living in Canada. And my parents really encouraged me to get vaccinated because I wanted to, I do a lot of things outside. Like I go to school, for example. I do, well, not anymore, but I did sports teams, but my parents encouraged me to get vaccinated so that I can benefit from the summer and enjoy myself and just be safe in general.
So you are more of what you hear in the school news and so on, and immediately you were convinced, Aya?
Well,
so your parents didn't spend time convincing you is good, is important, and so on, or you just got convinced by the message from the government?
Well, I got really convinced from my parents because usually I just agreed with them right away because usually they always they did the research and everything to see if it was a good vaccine, and we asked doctors and stuff, and I just really agreed with them.
And you mentioned very good points here. You said because they already did the research, like Salma, one of those who did the research. So you believe in the research and science. You are This is really great to hear from a 13 years old. So you believe in the research and the science to save life?
Yes, I do.
Excellent. After you had it, what happened? Did you have any issues? I don't want you to scare anyone, but tell us what happened. How did you feel after you had?
Well, I mean, after any vaccine, you really like feel tired, or your arm could hurt, or wherever you got the shot. But for me, I felt kind of tired, like for like the first day, and then the next 2 days, my arm just hurt a bit, but like then it just literally went back to normal, and I was fine.
Okay, what is your message to your age in every country, but particularly the countries where it is available now? What can you say to them? The doctors have already told them, and they encourage everyone to go. What else can you do, or what a different message could be much more stronger from you, because you are 13 years old. You can say it to them, they can listen to you. They may not necessarily take it strongly from us. What can you say? What different message can you say to youngest generations to go and get vaccinated as soon as possible?
Well, if you want to enjoy yourself and have fun and just be safe, then I recommend for you to get vaccinated, because it'll really make a difference and it'll help with your immunity. And it's always great to take care of yourself. So go get vaccinated.
والله ربنا يحفظك ما شاء الله عليك. Thank you very much. Let's go to Karen in Manchester. Karen, can you hear us? Thank you very much, Aya. I will come back to you. Let's move to another person. Karen from Manchester, can you hear us?
Yeah, I can hear you. Sorry.
Yes, yeah, if possible, can we see you, or is not possible?
Oh, I don't think that's possible. Sorry.
No problem. Go ahead. Tell us, what do you want to say? How old are you, and give us your experience.
I'm 17. However, I've not had the vaccine yet. I've not been invited for that yet. So, and I'm just wondering to like get more insight into what it's about, and because I'm a bit nervous about it. I don't really like injections.
So you're nervous because you don't like injection in general, nothing to do with the vaccine.
Yeah, mainly because of course I trust it, but I just don't like injections.
Okay, and so far, what do you know about the vaccine? Because it starts to be offered now in the UK, and I believe some have already taken it. My daughter received it. My daughter is 17 and 9, so that she's in the 3 months before 18. So what do you know so far? What is your worries, apart from your worries about the injection? We all don't like injections.
Yeah.
But generally, what your specific worries about the vaccine?
Well, obviously I've heard about AstraZeneca causing blood clots, but I think the side effects is what scares me. And again, like Mona said, how about the availability of like Pfizer and things like that because of the temperatures that it needs to be. Well, that's it really. I don't really know.
Okay, let's listen. Dr. Salma, you got a worrying 17 years old. What can you say to her?
Let me just say, Aya and Karen, thank you guys for coming up and being brave and talking about this. You did a great job. Karen, as far as the needles are concerned, I know a lot of people have true phobia and they're really scared and they hate sharp objects, let's say. But I want you to think about this. The discomfort you get from that moment of half a second where the shot is jabbed into your arm and comes out is going to save you a lifelong problem with having any issues with this disease, with COVID. So you always look at, the pros and the cons. So, okay, pros prevents COVID, con, it hurts, but it's only going to hurt for a little bit. You may feel like crap, if I may say, for 2 or 3 days, but you're eliminating or diminishing your risk of getting COVID, getting hospitalized, getting a bunch of IVs and tubes inserted into all parts of your body. And that would be for several days, maybe weeks. So that's kind of, look at it that way. Something, I think when you think about, okay, this is just for now and I'll go through it and it'll be over and I'm done. Sometimes that helps you get over that anxiety that you have associated with the injection. When you're overthinking something, you kind of make it this big thing in your head when it's really very underwhelming. As far as the side effects, and Dr. Nona had mentioned that before, the blood clots, this and that, COVID will give you those things for sure. The vaccines, the side effects, any serious side effects reported were extremely, extremely low, almost negligible, but they still happen, okay? And then keep in mind, this is a lot of reporting going on. A lot of people are paying attention. Correlation does not mean causation, okay? So if people got the shot and then they got a blood clot, we need to look at that. And that's what they're doing. But if you get a shot or the jab, as you guys say in the UK, and I get hit by a car, it will be reported that patient was hit by a car as an adverse event, but we know it's not related, right? We know it's not related. So there's a lot of angles to look at different things, but you have to have all the information. I encourage you guys to get your information from your doctor, from trusted resources, trusted health officials, and not social media videos and things like that.
Dr. Salma, several questions, but I will try to be quickly three. You tried this in the US. To what extent what you have tried or the trial, you will be involved with other teams of course. It applied to kids from Africa, from Middle East. I mean, I remember when the vaccine, it was being tried in different, even the AstraZeneca was tried on people from Brazil, South Africa, British and others. If the kids one is also being tried across the whole world, as far as you know, because the kids you tried on them, I know there might be diversity in the sample you had, but still not. Do you have any knowledge about whether it's been tried in not South Africa, in Africa, Middle East, the trials? Do you have any something to say?
I'm not aware of any trials in particular from Moderna or Pfizer overseas, but I do know Johnson's, they're doing their pediatric trials overseas. And the other, the vaccines from China and India as well. So, yeah.
Is that any reason for worries or concern? The fact it is not being widely tried, and now we're going to give it to our kids?
No, I mean, it's the samples of patients who are enrolled in the trials are huge compared to other vaccine trials. And, we're fortunate enough to recruit a lot of people in a short time and able to come up with the results so quickly. So, with those trials, we always try to make sure the patients are diverse. So not only Americans, but they're of different nationalities as well. And different walks of life. We had kids with different underlying chronic diseases participate. So we had a great variety of patients enrolled, and the results were consistent. We kind of know how this, understanding how the vaccine works is important. Understanding the molecular biology that's involved, the immunology that's involved. We all have basically the same type of, our immune systems work the same way most of the time. And so when you look at the way the vaccine works, it should work across the board. Okay, it should work across the board because we understand the science behind it.
Okay. Not to apologize, but to clarify, many people have been asking me Arabic as people in Sudan can understand, but really when we advertise for this, because many people approach us here in the UK, because it's being offered here. and I believe in other, and you can see from Aya earlier, like in Canada, they already been vaccinated. So that's why most of the kids, we're really focusing on them, and the parents, they are mostly those who they say they prefer the English. We will definitely, we have done it before in Arabic, all of those people spoke in Arabic, but it's just, this is very special because now it's being offered, and the schools are, in the UK, for example, it's quite arrogant because the schools are open, the country is open, and I think that's why we're talking in English. I do apologize for those who can follow us in English. Now, Selma, you have another question. I think this is Dr. Sarah. Can you say something about the post-COVID inflammatory syndrome, and if you have seen that in vaccinated kids?
Yes, so post-COVID inflammatory syndrome, this is a condition we're seeing. As I mentioned before, it's not the immediate effect of COVID with kids, but there are some other chronic issues. So in some cases, about a month after an infection, if a child gets an infection, they develop a systemic illness that almost resembles, sepsis, if you will. So all your organs are inflamed, and these children can become very, very sick and need ICU support. And then, if, then they can deteriorate and die. So that's, that was kind of the concern when we started with the vaccines. This was a question that we were looking to see. Unfortunately, there are no reports of, it's MISC. There are no reports of MISC post-vaccination reported anywhere. So that's very reassuring that at least we know if your child's vaccinated, even if they catch COVID, it's not going to progress into MISC. So.
Okay, Selma, before this question, maybe I can also pass it on to Mona, but let me ask you before I go to Mona, is about the herd immunity. It's from Naila. She said, my question is about the herd immunity. It normally works for all types of vaccine from very long time. Why it doesn't work in COVID-19 case? And if it does, why governments need to vaccinate the whole population instead of the 80%? This term is being used heavily here in the UK, but before we go to Mona, maybe you can have your shot. Herd immunity.
Herd immunity. So
did it work or didn't work in vaccine on COVID-19?
So we have not achieved herd immunity, and as far as COVID is concerned, the definition of herd immunity is where 80% or more of the population is fully vaccinated or immune to an illness. So if we have, let's say, I think in the US, only about 50% of the population have received at least one dose. So it's very low still. So what happens is that you have half the population where this virus can continue to spread. And as long as you have a virus that is spreading and replicating or dividing, and then it's going to mutate. That's what viruses do, because it's survival of the fittest. So only half of us are vaccinated, but there's this other half where this virus is going crazy and they're realizing, oh, well, okay, there's this thing, these people have that, so I'm going to switch my DNA a little bit so I can continue to spread. And so that's why we have this problem now. We're having these surges here. And even though, there are people who are vaccinated and there's access to vaccine, but because there's still a lot of vaccine hesitancy due to the misinformation. So unfortunately, if we don't get to 80% quickly, this virus will continue to mutate. And
okay, Dr. Selma, again, there's a question. It was very early, but I lost the, yes, here. Does the vaccine have any side effect on kids taking seizure meds?
No.
No, it doesn't. Okay. Doctor, okay, I will do you, okay. We have with us, I'm going to go to Dr. Mona, but Dr. Sorry, because I got an expert here also. Well, any plans to go? Okay, if any plans to go, this is from Dr. Sawaddin from Qatar. But Dr., I'm going to go to Muna. But if you would like, after I go to Muna and I take one opinion from one of the children, if you want to give us any update what is happening, not just in Qatar, but in the Middle East, that will also be useful if you would like. Muna, Dr. Muna, I think there are lots of things going on here, but maybe you can take that question. Any plan to go beyond 12? And then you can give your comments on what you hear, particularly from Karen. Not the scares, she's scared from the injection, but more of, do you see that a lot, say in Manchester or in other places where our kids are a little bit hesitant to take the vaccine in the UK?
Yes, absolutely. And I think it's the vaccine hesitancy, which is now the problem, which is creating an inequality where people who have access to the vaccine and have been vaccinated are less likely to get COVID. They're less likely to get any severe consequences of COVID. But what happens to the other 20% or 30% in some cases, like in a city where I work? So we have 30% of our adults haven't been vaccinated. And the question is, who are they? So they are the ones who are more hesitant. Unfortunately, they are the ones who are more disadvantaged, more susceptible to the myths that are going around, more susceptible to believe in that misinformation, and seem to be waiting. So they're waiting for more evidence or waiting for more information when actually they're now in the minority because they're now 20% or 30% of people who haven't been vaccinated. So most people, you know, are really exposed, poorer neighborhoods, people who have to go out and about. There's no way for them to stay safe at home or to, they have been working right through the pandemic and they're still hesitant. They're still really concerned about the vaccine more than they are concerned about COVID. So why is that? They seem to think that COVID is now normal for them because they've been out and about in it. And the vaccine is coming new, whereas actually it's the other way. COVID is the new virus. And the vaccine is based on old, tried and tested methodology. But one thing I wanted to mention about herd immunity, where, for example, is 80% of the population vaccinated enough? No, it's not enough because the other 20% are still susceptible. So I'll give the example of measles. Measles vaccine is one which is 95% effective. We give 2 doses of the measles vaccine because we want those 5% who weren't protected to have another jab so that we can get to 99% effective cover from measles. But right now we have measles outbreaks. Where are those measles outbreaks? They are in the communities that did not take up the vaccination. Which communities? Some faith-based communities, some of them from ethnic communities, they haven't taken up the vaccination for some sort of vaccine hesitancy, and we still have measles outbreaks. So the question with COVID is who is protected and who isn't. So one of the really important things we found when we asked 16 and 17-year-olds to come up for their vaccination, when they came up, we discovered that they had grandparents or parents who weren't vaccinated. We discovered that they were carers and they didn't realize that they were carers. So they should have been vaccinated and their 12-year-old, 13-year-old siblings should be vaccinated. So I think each time we open up a new category of people who can come in to be vaccinated, we're exposing the rest of their community, their families, to the realization that this vaccine is important. If you're 70 years old or 80 years old and you haven't been vaccinated yet, and here's your granddaughter coming up to be vaccinated, then the grandmother will come for vaccination with her. I think it has to be word of mouth that this is a safe vaccine and that we are coming across individuals who were eligible 9 months ago and still haven't been vaccinated. So young people coming up for vaccination, take this as your mission. Take your jab, but also check your loved ones, your families, your friends, make sure that they get vaccinated too.
And Dr. Muna, in the UK, there was lots of talk. I myself was involved in a couple of things to do with ethnic minority and Black and ethnic minority. The taking of vaccine during the Black and ethnic minority was lower than the other group. Is it the same case with kids, or have you not yet seen any statistic? I mean, if our Black and ethnic minorities kids are less likely or more likely to take the vaccine, or you still haven't got any detail of that?
So I think what will happen is it will be the same as what we saw with adults, The people coming up forward for their first vaccine are the ones who are more affluent, who are more educated, who are more able, who have been itching. Actually, we have people who've been asking to get vaccinated before they were eligible for a long time. So the minute they become eligible, they'll be the first people at the front of the queue. The people who really need to reach are the ones who are still hesitant, who are delaying it, who don't think it's important. Well, I'll have my exams first, and then I'll go to the vaccine. So in the priority of their day-to-day living, they don't seem to put the vaccine high up, and actually they are the ones who are more exposed. So we will see that, but at the moment, we have individuals who are aged, let's say in their 20s and 30s, we haven't had as much uptake as individuals who are in their 70s and 80s. Why? Because the 70 and 80-year-olds have been being invited for the last 9 months. The 16 to 17-year-olds have only been invited 1 week. The others have been invited for just a few months. So the uptake is slow, but it will catch up. My question is, who is delaying that vaccination? We wanted you to be up front of the queue. If you were a carer, or if you are one of the disadvantaged BAME groups, the Black ethnic minority groups, we wanted you to be in front of the queue. So if you've been invited, just take it up straight away. Take the next available vaccine slot that you find. So when people come to book the vaccine, we find them picking a date a month later, thinking that, okay, there's more slots in the next month, I'll go next month. Actually, there's 1 slot tomorrow, take it.
Okay, thank you very much, Mona. Let's take another scenario. Maya, also from Canada. Maya, you also been vaccinated, right?
Yes, I've been vaccinated.
Can you hear me, Maya?
Yes, I can hear you.
Your voice a little bit breaking.
Yes, I can hear you. Is this better?
Yes, Maya, thank you very much for coming. I would assume also it's very early in Canada, but you had taken the vaccine, right? How old? You are 13 as well. So tell us your experience, and particularly you have listened to both doctors now, and what can you advise? Just tell us your experience. It is the same like Aya or different?
Well, when I first found out about the vaccine, I was excited to get it, but I was also nervous at the same time because I didn't know what to expect. But then my mom told me, okay, you're allowed to get the vaccine now. And I was like, okay, sure. But can I do a bit of research on it? So I went online and I did a few searches, and I also spoke to my uncle. He's a doctor, and he said, yes, it's worth it to get it. So then I just got it.
And was there any other side effect than so far being mentioned by Dr. Salma or Mona, or which we heard about them? Is there anything else? Did you feel anything else apart from what is being mentioned so far?
I had a lot of pain in my arm, and
A lot of pain?
Yeah, in my arm, and I was exhausted, and I felt a little dizzy after I got it, but otherwise I was fine.
Okay, I'm going to ask you, shall I call it a difficult question, but I know you're up to it. Now, you are lucky. Many of the kids I talk to, or families in Sudan or other poor countries, they say you are lucky. You're talking about things. Even now, people are criticizing us for talking in English because we are trying to target you guys here. Now you are lucky. You have been given the vaccine. You are so educated. You are in Canada, and we have people in the UK. What can you say to your 13 or 14 years old friends, family in Sudan or other maybe African countries? I know you are sympathized for them. They don't have this vaccine. But what can you say to them about, what can you advise them to do? They don't have the vaccine now. Can you have any thought with them?
Well, I would just say be safe and trust in doctors, because you guys are heroes, and I just think that you should get the vaccine and stay safe so you can get the most of your life and just feel better about yourself and try and protect yourself and others.
Okay, thank you very much, Amaya. Sarah from my sister, can you hear us? Sarah? Sarah Khattab, can you hear us?
Assalamu alaikum.
Alaikum assalam. How are you?
I'm fine, thank you.
Sarah, can you tell us how old are you and whether you had the vaccine or not, and what is your experience?
I'm 16 and I've not had the vaccine yet.
Okay. And so far, are you excited like Maya, or you are concerned like Karen before?
I'm excited because my whole family has been vaccinated and I'm the last one.
So far, what do you know about it?
I know it will help to prevent me from getting the coronavirus.
Okay.
And I'll be allowed to go out and not worry that much about catching the disease,
Okay.
virus.
So you are quite looking forward to have it.
Yeah.
Okay. And are you not concerned at all about all these side effects you have heard so far?
I mean, I'm a little bit concerned, but it's not going to affect like a lot of people. Sorry, that's my brother.
Okay. Okay. So you're going to get it once you've been invited, right?
Yeah.
Is that the case within your friends in school or in the neighborhood?
My best friend is really apprehensive on getting the vaccine. She said that she wants to wait like a few more years because she thinks that the thing is that no, not a lot of people know what's in it. She's scared about the side effects.
So she feel not many people know about what in it. You mean?
Yeah,
she
she's
still
scared
don't
that.
believe. But
Because
Aya, before
she's
she
heard
said
a lot
she
of
believe on this
stories.
scientist, do you believe what is in it, and you trust it?
I trust it,
Okay.
but
So
she doesn't.
they want to wait few years to get vaccinated?
Yeah, like when she's 18, so 2 years then.
Did you, or I can ask Selma again to tell you what's in it. I know she said it, but I will go back. But Sarah, just before you go, we will ask Muna, there is a rumor going on also. I hear this and I am going to ask Muna or Dr. Muna, maybe in the US is also the same. Some people here, parents said they are concerned if they don't get their kids to be vaccinated, they might end up not being allowed to go to swimming pool or gym and so on, because with the adults, the Prime Minister in September is going to issue lots of regulations. So for example, if you are not vaccinated, you may not enter X building or a theater or a music festival or whatever it is. If there is any concern like this within your age, that if they do not get vaccinated, they might come a time where you will not be allowed in, like a swimming pool or this kind of places, if you can't show a vaccination certificate?
Yeah, 100%. I think that might happen.
So you feel it might happen?
Yeah, I think it might happen.
Okay. Thank you. We will take that to Muna, because Muna, this is a thing going on now. Adults are feeling the Prime Minister is pushing them to, I don't know, violating their human rights not to take it. And you have seen that. I'm sure you follow it. So I know you can't tell us. You are. I know this is a political question, but do you think we might come to September, or I don't know, October or November, and our 16 or 17 years old who has been offered the jab, if they haven't taken it, maybe they will start getting treated like us. You can't fly like some places unless you have 2 double jab, because in the past kids are not being asked, they were exempted. But now, if the government is offering them, maybe they will then be treated like us. If you don't have the double jab, you cannot travel to Germany or France, the same like us now. So do you expect that? I know you can't tell us what we not publicly available, but do you expect that, Muna?
So I think there is an issue about freedoms and flexibilities, about being able to do some things. And when the testing first came out, you know, that daily testing or twice a week testing, when it came out to enable people to do things that they couldn't do otherwise. So the problem with testing is that you have to do it all the time. So if you are going to attend an event and you need to be tested and prove that you're negative before you attend, you have to keep repeating that. But with a vaccine, it's 2 doses. So it's a much easier way to prove that you have either just recently recovered because you've tested positive about at least a month ago, for example, or in the last 3 months, or you've been tested today, or you've been vaccinated 2 doses. Now, how much of that will be used for by law or by guidance is still up in the air. We still don't know. But I'll just give one example. That it has now been, that law has been approved that if you haven't been vaccinated with 2 doses, you should not access a care home. You should not go into a care home to work. You should not be going in as a contractor or as a professional or as a care worker or as an admin secretary or a cleaner. You should not go in unless you've had 2 doses. And we know that that is going to be a huge problem, because we won't have 100% of staff working in a care home being vaccinated. This mandation seems to explain 100% of them will be vaccinated, unless they're medically exempt. So because for some reasons they couldn't take the vaccine, they're extremely allergic to something in it, for example, but that, okay, let's say 10%. So we're expecting 90% of people who will be working in care homes to have been vaccinated. And there's going to be a consultation about working in NHS, health, and other adult social care settings. So that is a huge population group of people about being able to go to work if they haven't been vaccinated. So everything that people are talking about, travel, etc., all of that is almost like it's a frivolous luxury. But actually, you and your job, that is a really, really big issue. So it's a critical issue. That the only kind of like way I can explain it is you either have had to be recovered from COVID recently, or you tested today negative, or you've been vaccinated with 2 doses. That seems to imply that you are safer as someone to associate with in those very critical settings like care homes or like within the NHS. Of course, in those critical settings, everyone is wearing personal protective equipment, all the masks, etc. None of that has come down. So it is still a big question. No answers yet. The political answer will win.
Thank you very much, Dr. Mona. Selma, I got very critical question for you, but I can see he's connecting now. Moses Natai from Uganda, I can see you are connecting. Just to give you a couple of seconds. If you, or we can ask you, Selma, and come back to him. Very keen to get his views from Uganda. Now, Selma, several questions. Can you, in a very simple way, I know you can, you are a good doctor, you deal with kids, you know them better than us. Can you tell, that's a very good question, can you tell them what's in this vaccine? In a very simple way, they can understand you. What's in this vaccine? Because you can see her, she said some people are in the UK worried. What's in this vaccine?
So as far as the Pfizer vaccine, since this is the one that's being offered to children, so it's molecular biology, but I'll try to be very brief,
okay,
and as simple as possible. There's a system inside of our cells, okay, which involves something called DNA, which is our blueprint, okay. There's RNA, or messenger RNA. So we have the blueprint. So think of messenger RNA as the architect or the developer when it comes to buildings. And then you have the ribosomes, okay? And think of those as the workers, okay? So we have this kind of thing. And what they do is the DNA, mRNA, ribosomes, they work together to produce proteins in our body. And these proteins make everything, basically everything in our body, okay? Everything made of protein, that's how it is manufactured. So we know what the SARS-CoV-2, the coronavirus DNA is, that was isolated January of 2020, sorry, 2020. And they were able to isolate the spike protein DNA. So if you guys all remember, the coronavirus is round and it has all these little nubs sticking out. So those nubs are called the spike proteins, and these are what make it virulent, and make its penetration into the tissues and all that problematic. So we know what the DNA of these spike proteins looks like. So they made RNA in the lab that's able to translate that. And then that mRNA is the vaccine. And that's basically it. And so but it's very, very fragile. You have to understand, RNA is very fragile. Inside our cells, we we make the RNA is assembled and taken down multiple times a day as it reads information and produces the protein. And so this is the same for the lab-generated mRNA. It's very fragile. So they figured, how do we package this and deliver it into the body in an effective way that it doesn't get damaged? So, and this is the difference between the two brands. There's a fat set like capsule. They encapsulated the mRNA that was lab generated inside these globs of fat. So it's basically two brands of fat globs. So think Adidas and Nike, but it's Moderna and Pfizer, but they're the same. Okay. And this is why the temperature difference is different. That's all.
So as a scientist, as a doctor, as a consultant, I'm not going to put you hold accountable on the vaccine, but you definitely, it's a safe ingredients in simple way. They don't have to worry about it. دكتورة, there is question in Arabic. هقول لك بالعربي and then I translate it. If there is a specific age of the children which might affect or conflict with other doses they are taking, kids are taking lots of, you're a pediatrician. Does it conflict or interfere with any of the other vaccination in particular ages?
No, at this time, we know that it's safe to take the vaccine along with the regular childhood vaccines or any time before or after.
Okay. Does it have any impact if you have a mix of brands in the second dose?
So we don't have data about this. It is happening. It seems to be happening based on supply issues, but there's no data to say, yes, it's okay, go ahead and do it. So proceed with caution, and you can just follow the recommendations of your local authorities based on the supplies available.
Okay. Now, Moses, Selma, let's see if we can get more. Moses, I can see you from Uganda. Can you unmute and we would love to hear from you. Can you hear me, Moses? Excellent.
Yes, I can hear you very well.
And can we see you on camera or it's difficult?
It's kind of difficult where I am
No
now.
problem.
Maybe.
No,
Yeah.
I'm very grateful. No problem at all, Moses. I'm really grateful. Tell us who you are, your age, and your experience with the vaccine.
Okay, my name is Moses Levintai. I'm a medical doctor trained from Uganda. I am 25 years of age, and I'm currently pursuing my master's in immunology and clinical microbiology. So my experience for us in Uganda, we've had the AstraZeneca vaccine for now. We've not had any other vaccines going forward. But maybe our experience with AstraZeneca in Uganda has, let me say, we've not really had a lot of issues apart from stocking issues and availability, but otherwise we've been doing okay. My question could be in the sense that since we may have other vaccines coming forward in the country, and some people got the chance to get only the AstraZeneca dose, the first dose. If they got the Pfizer or the Moderna or any other vaccine, could that be a good substitute for a second dose, or they have to start all over again with a new vaccine?
Okay, which is the question we just asked Dr. Selma. But Moses, I believe your youngest brother also has been vaccinated, right?
I didn't hear that very well.
My understanding, your youngest brother, he was vaccinated, right?
Yes.
How old is he?
Was. My young brother is about 22 years old. Okay.
And you both got the AstraZeneca?
Yes, definitely.
And given you are in the medical school, what is the situation with 17, 16 in Uganda? Are any chances of vaccination happening in that age?
For now, no. For now, we are only vaccinating people who are above 18.
Okay.
And the priority currently is with, first of all, the priority is above people who are above 50 and essential workers. So teachers, the teachers and the doctors and the other health workers and those who have comorbid diseases like diabetes and hypertension, and those above 50 happen to be our target groups for now. So we're not really venturing into vaccinating people below 18 years for now.
Okay. I will let Dr. Salma, we asked her that question just before we get you on air, but we appreciate your time really. Let me ask Dr. Salma again. Salma, sorry, can you answer it again? Different doses, sorry, different brands, as he said, because in Africa, the logistic will play a critical part. I'm sure you know that. For example, last night or 2 nights ago, Johnson was arrived, I think 600 doses arrived in Khartoum, so they will have to use it. So you know the situation in Africa. So yeah, you can respond to that. I know you answered it, but maybe do it again.
Okay, so for Moses, hi. There's no data, there are no studies that have shown whether it's a problem or not, or if you can mix doses or not. So we don't have that data officially. However, you do hear reports, there are people who are doing that based on availability of the vaccines. And so that decision should be deferred to the local authorities, the healthcare authorities, who know which supplies and which vaccines are there.
Okay, Selma and Mona, the same I asked the youngest difficult question, I want to ask you also a difficult question. Now, I don't know if you have seen or not, but recently, this is very recent, Mona and Selma, I think last week or something, there was a big party, a rabbi in Sudan, you know, the rabbi in the US. I have never seen this before, to be honest, in Sudan, I have never witnessed it. But this situation is also happening in other parts in Africa. We have seen it, not in much. But it was a big surprise in Sudan, a huge, I don't know what you call it. It's a party, what do you call it? The pictures are youngest, all of him, he's a rabbi, okay, in this COVID. The same like the, I think more or less the same like the raps, you know, the big event when you have like Bafdadi and all that kind of people. I don't know him. I have only heard about him last week. But the shocking scene, youngest generations, boys, they were almost, you can't even think of social distancing. They're like this. All of them with their mobile phone in this big hafla or party, whatever it is. Huge amount of, I don't know how many thousands were there, how the government allowed that, and so on and so forth. But there's no question, transmission will be huge. I mean, not just because of both of you are Sudanese in origin, but if you have listened to Aya earlier, she said she trusts you, she trusts the scientist, she trusts what you do, what you have said. What do you think about our youngest generation of, I think around 20s, most of them are teenagers, attending a party like this with that nature? It's not just COVID, you will take any virus available there. I mean, I don't want to take you into the politics, but how serious this will damage all the efforts people like you and governments are doing. I mean, from one side, we have seen Johnson arrived in our airport, 700 doses, and you already got thousands mixing like this for a night with this rapper, or I don't know. I mean, what can you say to this? Particularly, this is more of a policy. Are you aware of these things happening in Sudan?
So I'll come in, because what you're describing there, Prof. Alam, is a mass gathering.
It was huge.
A mass gathering. And we have had mass gatherings before, right in the peak of COVID. We have had that with weddings, with funerals, with state occasions, and so on. We've had it with protests as well during COVID, where people feel really strongly about something that they are willing to risk a lot for a few, you know, to make a stand or for a few moments of pleasure. I'm reminded of Selma's earlier example about that needle, where a slight pinprick compared to a lifetime of pain. And this is actually what is happening, where people turn up at these mass gatherings for a moment of lightheartedness, happiness, flippancy, ignoring the context, enjoyment, whatever reason people have turned up once in a lifetime, etc. And actually what they're doing is they are exposing other people to what they themselves may be carrying without any symptoms. So there will be a number of COVID carriers or people who are even unwell with coronavirus or any other virus, or any other illnesses in that mass gathering. And what happens in that space is that they're sharing indiscriminately that virus. What happens is that 2 weeks later, people who attended that gathering will start to become unwell, or the virus, they will start shedding the virus while they themselves are not aware, and they pass it on to their families and their loved ones. So we can always map peaks of a pandemic following incidences like this. So what we can predict is 2 to 3 weeks from now, we will have a huge peak of coronavirus cases. And another 1 or 2 weeks later, we will see mass deaths, when it will be too late to be able to stop that. And we have experienced that as a country, sadly, many, many times. The problem is people don't connect the deaths to the incident because it's 3 or 4 weeks later. And people who attended that one moment of enjoyment don't realize the consequences that they have inflicted on families of people they know and people they don't know. SubhanAllah, this is the reality of the virus. It is showing us human behavior and what is driving human behavior. Some people who are hesitant, some people who are careless, some people are extremely cautious. But you can see the extremes of human behavior displayed. Subhanallah.
Okay. Thank you, Amuna. I remember when I talked to Selma, we agreed in 1 hour, but I knew it was going to be 1.5 hours. But I'm grateful to all those. I really don't want to take from your time, both of you. And but Selma, I will give you the final word, unless one of those youngest. If you have any question, please raise your hand from the people in the Zoom, particularly the youngest. I can let you ask the final question. But Selma, Muna, I remember many times, at least the one I have witnessed, there's so many messages being delivered here from London, from the UK, by the public health group, by the many events, not just with Muna's group, but many, even to the Supreme Council in Sudan, every place, the message for policy, because we are very fragile. We are not talking about the UK or Florida where kids are going to be vaccinated. We're talking about country, the adults are not vaccinated. I don't know what can I ask you, Selma, but can you send a much more stronger message for policymakers without talking politics? How serious this virus is still out? And you are a scientist, you are leading trials, you are in one of the top scientific country using science. Can you send a very strong message to the youngest and to the policymakers? These deaths, like Muna said, they are not thinking of this, they're just thinking of pleasure. It was very serious, it was shocking. And many people, they told us, in many countries actually, in Tunisia, in Egypt, they said there's no COVID at all. People are just on the street and so on. Can you say any strong message, maybe, and particularly for the youngest? I like what Maya and I said before about you want to enjoy your life. Karin said that, Sarah said that. They said they're going to be vaccinated so they can enjoy their life. They don't want to die. They want to be healthy. So what can you say to the Sudanese or maybe African or whoever countries, they are not taking it seriously? Middle East are taking it seriously. In the Gulf, I've been told, UAE, Saudi Arabia, and no wonder UAE was lifted, is now moving to the amber. Saudi Arabia already in amber, not in red, because they are doing well in terms of controlling this on the street and so on. So any final strong message to push policymakers to control this kind of completely unacceptable scenes, if you like?
What I would like to say is COVID is not the only disease in the world, okay? However, because of what is happening, you are going to, if certain rules aren't implemented, social distancing, mandatory masking in certain indoors, discouraging large gatherings and things like that, what's going to happen is you're going to have a surge. And as Dr. Nona mentioned, it will happen. And we've seen this happen multiple times in different countries and this exact same timeline as she mentioned. And what happens if you are an underdeveloped country, your hospital systems will be overwhelmed. There will be no beds for your patients because all your beds will be occupied by COVID patients. So if you have a heart attack, appendicitis, whatever, you're out of luck. It will be difficult to get those people any treatment. Your healthcare workers are exhausted. It's been a year and a half. We are very, very tired. It's those, a little tiny bit of sacrifice can help all of us get through this until we all have vaccine and we're able to get everybody vaccinated. Don't put a political agenda ahead of human life, just to get votes, just to do whatever it is that politicians do. Public health is not a political issue. That's it.
Okay, thank you very much, Dr. Salma. Maya, yes, go ahead and unmute yourself.
I had a question about the vaccine, and I'm just wondering if it'll become something annual like the flu shot if things get a little too serious.
Can you repeat again, Maya?
Will the COVID vaccine become something annual like the flu shot?
Okay, Salma.
We don't know yet, Maya, because it's been they've been out about a year now, and those people who participated in the trials are being followed. So it may or it may not. But if it does, it's not a big deal. We get an annual flu vaccine. We get multiple doses of several different vaccines to get to that immunity that you want. So we'll have to wait and see.
Okay, Aya. Unmute yourself.
I was wondering, how do doctors come up with vaccine names?
How the doctors come up with vaccine?
Their names, like how do they name them? Like Pfizer or Moderna?
Okay.
What's the process of them being named?
Selma, any chance? I don't know.
It's just you pick a name of a company, and the Pfizer vaccine, the company is called Pfizer, and they have many different types of vaccines, different medications that they make. It's a big drug company, so that's what that is. Johnson & Johnson, you may know the lotion and all of that stuff. So they do medications and they do vaccines as well.
Okay, I think we have to finish it here. It's 3:30. We took less than 1.5 hours, but by all means, we are very grateful to all of you. Thank you very much. And as I said, this was session primarily designed in English, yes, because we wanted to, as much as possible, because it's not just this 1.5 hours, but it's going to be circulated and shared. So we want the diaspora, we are very keen on the people who are Sudanese or African or all this ethnic minority living in the UK. And all the kids we've spoken to, they prefer the English, they speak Arabic. You have listened to them. But the second thing, we are very keen. We still didn't find the resources to do it. We will do it very soon. We notice in Sudan in particular, because we do have a specific project on Sudan, on the diaspora, many people told that they're looking for role models. And I really I have said this many times, people like Nona or Salma and others, like Suhair and others, they could be, and it's not they could be, they are an inspirational role models for young generations in Sudan, not necessarily girls. Yes, we are very proud, they are girls, they are women, yes, but they could be inspirational to everyone. And I think we just wanted to understand how this can happen. I think it's just a pure conversation. I remember I attended one where they brought in a big event here in London, a Black lecturer from Imperial College to talk to young girls and boys, but particularly girls, to attract more young Black girls into physics and chemistry and so on. So why not? We want to do this really. And it's just, we want to make it in a way, and I wish Maya or Aya or Sarah or Karen, all the youngest generation, we are, yes, we have the focus was on Sudan, diaspora Sudanese, but the project is huge, include Jamaicans, Ugandans, every place. Moses also, if you have ideas, come to us because we can use both languages. We want to see how we can really get these people to work with you, at least talk to you, their journeys. There's a video of Dr. Salma, I think it's in Arabic, I can't remember, it was in Arabic. She talks about how she reached where she is now, because at the time, she was in the whole news about the first clinic in Florida being selected to start that trial. There's so many, many inspirational women, not necessarily Sudanese, but there are many from Egypt, from Tunisia, from Caribbean, from we got, for example, Dr. Gail Rigobert from West Indies. We really want this, but give us ideas. I really want the ideas to come from the young, how they would like to be connected with people like Nona, Salma, Gail Rigobert, just to mention many of the people, not necessarily senior academic, but they could be in the front line. And I would like to finish by, I really hope all those in the developing countries, particularly in Africa and in Sudan, because that's where they can at least, we connect psychologically with them. They need to really take these messages seriously. Those people, they said to me, أنت عالم بتكبر فيكم الناس. لكن I'm not والله بكبر فيكم الناس. لكن it's serious. يعني Mona is a director of public health, so she is responsible for the health of a huge area. This is under her control. She has to take it seriously. She has to apply the rest of this rule. She's a government, if you like, official somehow or another, taking care of people. Selma is doing great work in the US. She's in Florida testing the trials. She's treating kids. So those people are really have huge knowledge in their mind in leading countries. نحن ما نتفاخر باليو كي ولا اليو اس, لكن they are truly in the science base. They are leading countries, no question. UK and US and other countries, of course. So if you have people who are leading in these countries, I really want the politician, the public policies, the government, the public sector, particularly health, to take this advice very seriously. And we will stop here. Thank you very much, Moses from Uganda. I remember earlier I have seen Olivia, I have seen Gornash from Kazakhstan. Maybe next time you give us what's happening in Kazakhstan. And I have seen many people here. Nazar from Sweden, I can see. Yalla ma assalamu alaikum. Thank you very much. Hello, Olivia. Nice to see you.
Yeah, nice to see you. Well
Maybe
done.
next time you can also come. It's just the time. Thank you all. And we will continue. But I hope it is useful. We will share it. And thank you, all of you, those particularly from early morning risers in Canada or US. Yalla, assalamu alaikum, fi amanillah. Assalamu alaikum. I will. I stop the recording. I stop the live streaming. Shukran lekum. Thank you very much, Dr. Salma, for your time. Thank you, Dr. Mona, Moses, Samaddin, everyone, Nazar, everyone I can see here quickly. And thank you to all the youngest. يعني شكرا لكم. ربي الله يعرف من حسناتكم يا سلمى ومنى وغيركم. شكرا لكم.
Thank you all very much. السلام عليكم ورحمة الله. بارك الله
شكرا
فيك.
جزيلا، جزاكم الله خير. شكرا جزيلا، مع السلامة، في أمان الله.
شكرا لكم. شكرا يا دكتور. شكرا لكم كلكم. في امان.
So please remember, if we all help and do a little bit, it will make a big difference.